what happens inside an emergency room. Our Chase team has reached Dr. David Carr in Toronto. He is an emergency room physician. Dr. Carr, I understand you have a well-deserved day off today, but you were in the emergency room till late in the evening. Help me to understand what you go through in a day, because I know what I do in the newsroom. What happened yesterday for you at work?
Things are different. This wave, obviously, is spoken many times before, is very different than the first two. And I think we, as Canadian emergency physicians, really felt it wasn't so bad the first two waves, figuratively speaking. And with this wave, we are no longer imposters. We are now feeling what our American and European and Italian ER physician and intensive physician colleagues had, which is a real sense of fear, a real sense of logistical collapse, and a real sense of what can we wait for next, an impending sense of doom. So
you kind of have the hairs on the back of your neck standing up as you hear some of the modeling numbers. Does that fear come to the fore in what way? How could we fail?
Look, there is nothing more frightening than knowing what's about to come and knowing that there's not a lot that we can do, in the sense that what happens today, our numbers today, affect 2 weeks down the line. What we know is we need to make targeted strikes today. We need to move forward. We can't think of failures of the past, but we have to move forward and pivot, because there is an out of control sense amongst all of us.
But there is some control, except it falls on your shoulders. As I understand it, the control you would have is who gets treatment and who doesn't, sort of a triaging thing. How does that sit on your shoulders, Dr. Carr?
I think that's the biggest fear amongst frontline providers in the ICU and the emergency department and the internal medicine wards, that we would be playing the role of ethical triaging and just determining who needs care and who doesn't. That sort of rationing of care took place in Europe in the first wave. And we're terrified, and it's hard to imagine that some degree of that triage framework will not become a reality with the projections that seem to be coming, and we're going to hear in the next hour or two.
Dip your toe into the world of politics. Maybe you don't want to, but if you could do it for the next couple of minutes, what do you say to the Premier? What would you like for the information for him to have from you and your experiences before he actually talks to reporters in a couple of hours?
Look, Suhana, I think that nationally, provincially, and municipally, we're going to look back at this and we're going to see plenty of room for improvement. I think what needs to be done in Ontario is, one, we need to find human resources and find them fast. We need to have a provincial mandate and a national mandate to attract nurses and physicians to move through the provinces to come help the areas of need. We need to target vaccines towards those who need it most. Our shutdowns that we have are not working now. This is not the first wave. It is not about pots and pans of healthcare workers. That's not going to cut it. What needs to happen now is see where the chains of transmission are happening and close non-essential workplaces and places of worship, because they seem to be important areas that we need to stop.
And I suppose there's a message for, average Ontarians as well, not just for the Premier. Would it be do your part?
Well, doing your part is important, but I think this cannot be spoken any more clearly, is when I'm calling patients who have COVID, and that's one of our responsibility in the emergency department, is I'm calling 50 COVID positive patients a day. And what I am seeing is those who've received one dose, whether it's AstraZeneca, whether it's Pfizer, seem to be having a milder course of COVID. Maybe they only had it a week or two before their illness. But I think the call to arms and the call to action in the public is to not be picky, to please get your vaccine. These are desperate times. Take what is offered and be proactive to get it now. Don't wait for something else.
Yeah. In those calls that you make, and I didn't realize it, but I can see why you would do it, make the follow-up calls for people who are at home. Are there tears? Are there worries? I mean, we have heard stories about some of the ramifications of having COVID lasting way more than 2 weeks, months, in fact, people trying to relearn simple tasks. What are you hearing on those phone calls?
Look, often we're the first point of contact for them to notify them. Public health and contact tracing has enormous amounts of work. So we're employing emergency physicians, internal medicine specialists, family doctors to call patients about their results. I'm seeing them through their course, through their 10 to 14 days of infectivity. And obviously there are major concerns. And when you see someone and coach them through the illness and see it turn out positively, that's a real rewarding thing. But when you call someone and find out that they're actually in the emerge when they answer the phone and they're on oxygen, obviously you know where this is going. And it's different now.
Yeah. That might be, the motto, the bumper sticker. It's different now. I want to thank you for your time. I wish you health, David.
Thank you, Sue, and you as well.
Dr. David Carr in Toronto. He is an emergency room doctor.